tidbit is I figured out a way where we could utilize the resistive bracelets to help better mimic a capacitive current. So where I find this really helpful is when I want to treat a soft tissue injury, but still have my hands a little bit more so involved than just the capacitive current. So what we found is that when we use nitrile gloves in conjunction with the bracelets, it really helps that 300 kilohertz current mimic a capacitive current, and we hone more of that thermal effect in the soft tissue of the area we're working. Two favorite places to use this are at the cervical spine as well as around the foot and ankle. I have one video of each I'm going to show to you guys. And I know what you're thinking. Hey, how do you know this works, Dennis? And basically, me and my team, we did surface temperature readings, so with gloves and without the gloves. And basically, what we found was we were reading the temperature at the ground plate. When we were utilizing no gloves, we got a stronger increase in the surface temperature where the ground plate was positioned, compared to when we were using gloves. There was less of an increase in that surface temperature. So meaning we're, again, honing more of that current into the superficial, soft muscle tissue. So I'm going to share my screen quickly. First one is going to be up around the cervical spine. I'll play this now. So this is a woman I started working with for a whiplash related injury. She's about 6 months out at this point. So I'm utilizing the back four. Again, this is a technique I've used on the back three as well, using the splitters. Now the back four, I'm able to just use two separate bracelets plugged directly into the machine. So a little bit more power output that way. But you see I'm at 40% intensity here. So it's a pretty good amount of heat. And now I'm just really just working, trying to warm up that tissue around the cervical spine, the soft tissue around the neck, with less of the current dispersing towards the ground. Let me stop my share, and I have one other video now that I'm going to show you. This is working around the foot and ankle for a gentleman who had a posterior tibial tendon transfer. He was having a lot of pain in the intrinsics of the foot. You guys see that there? So I had been doing some soft tissue work into the foot. Right here, the video is really, my intern took this. It's me more doing the passive range of motion. But, and I'll pause there. So again, 40%. For him, I was incorporating a little bit of the high tens as well while I was doing it, trying to get more of a pain relief effect. But yeah, again, doing a little bit of light range of motion work, as well as kind of digging into I'll play that one more time, as well as digging into the foot intrinsics, really trying to loosen them up. They were giving him a lot of pain. He had a lot of tone in those muscles. So again, I have the ground positioned posteriorly on the back of the leg around the calf, and just trying to get, more current honing in the tissue that I'm working directly under my fingers. I really like this technique, again, for a couple different body parts, the neck being one of them, foot as well. I also, let me stop my share for a second, just want to piggyback off of what Dr. Tucker was talking about in regard to, hydration. What we're finding, and again, I talk about this in a way where to sell this technology to a patient, we all know all the immense benefits of the actual current, right? Cellular proliferation, microcirculation, oxygenation, vascularization, all that good stuff. I find that especially in Florida, people like the warmth, and they want to feel that warmth. And there's a couple factors I noticed are, contributing to the amount of thermal effect that the patients, feel. The first one is body composition. So generally speaking, my patients with more adipose tissue, they're going to heat slower than my ones who have more muscle tissue. Along those lines, when we're doing something active, which if anyone has been on this call before, they know I love to do this stuff with exercise, with movement. actively getting tissue contracting, that contractile tissue is going to heat faster than where we're just performing it as a passive modality. They're going to feel an increase in thermal effect there. Just a quick example, I have a gentleman who I had been working with. He played in the NFL. Guy's got to be like 10% body fat. We were doing an active exercise at only 20% heat. And that was a little too much for him. So again, not much adipose tissue on this gentleman. We had to take the temperature down from 20% to 10, just because it was, again, getting a little uncomfortable. So that's something I like to point out, for you guys and your patients. The last thing, and Dr. Tucker touched on this, is hydration. We find very, very frequently that our patients that are dehydrated heat a lot faster than our ones that are properly hydrated. And I see that, in the same patient, in concurrent sessions. They'll come in one day, we'll be working at 40% heat. They'll come in the next day and 40% heat. All of a sudden, hey, that feels really hot. My first question is always, have you drank water today? More often than not, the answer is no. So those are just three things that I've noticed really can enhance or inhibit the thermal sensation that your patients will be feeling. Thanks for listening, everybody.
Those are great. Thank you. Good job.
Hey, Dennis.
Yes, sir.
Don Fabio, a quick question. You're using high tens through the bracelet?
Mm-hmm. Yeah.
Wow.
Yeah, it's something I've been playing around with. I am getting a little bit of tingling through my fingers. The effect that the patient feels is not as strong, what I'm finding, as using the high tens through the R shock, or even doing the high tens from the applicator itself. It's something that I've just been messing around. That video is about a week old, so I'm still working that out. I'd be curious to know if anyone else has tried that. It seems though that the better effect for the patient, it has been using it with the applicator.
Okay. No, I just think that's cool, man.
Yeah.
That was a great tip. I know what I'm doing tomorrow.
Awesome. But yeah, the gloves is a good one. I really like that one, and I use it often.